Hi, it's Dr. Greg Grillo with ExpressDentist. I'm here to talk to you a little bit today about 9 facts that you may not know about gum disease. You probably have some idea what gum disease. It's a very common condition that afflicts the tissues around your teeth, the gums and the bone. And it's actually the leading cause of tooth loss in adults because the bone can deteriorate from certain types of bacteria and the inflammatory response that occurs in the body, it just ends up destroying bone. And again, it's the most common way that people end up with dentures. So if you notice a little bit of bleeding, it may be something you want to follow up on because bleeding may seem benign in your mouth, but it's really not. And it is usually an indication that there is some stage of gum disease. There's 4 stages of gum disease, and it may be that you're just in the first stage. But the other stages could follow, and the results of that can be pretty devastating. So let's run through 9 facts that you may not be aware of. Number 1, gum disease or periodontal disease is not confined to older people. So it certainly can be something that older people deal with, but it happens in all ages. And sometimes we see gum disease even in people in their 20s. They can have an aggressive form of that. And even kids can have early signs that there's gum disease, at least gingivitis, which could then convert to a more serious stage of the disease later on. And number 2, gum disease can be inherited. People don't really realize that this is one of those things where genetics does play in. Now, certainly our own habits and our other aspects of our environment can affect gum disease, but there's certainly a genetic link. So if you come from a family where mom and dad did lose their teeth and maybe ended up in dentures, it could be that gum disease is a serious condition that exists in the family. Number 3, periodontitis can be linked to other diseases. This is a fascinating topic all to itself that we should probably dive into at another time. But gum disease and the bacteria that cause it have been linked to all types of things, everything from diabetes to stroke and even cancer, especially pancreatic cancer. Some interesting evidence around that still needs to be explored. Number 4, did you know that gum disease may actually be contagious? It is contagious. And so we might want to be careful. How do you get it? Well, the same way any other contagious disease is passed along. Could be something like kissing, sharing toothbrushes, or using a common glass, that type of thing. So yes, we often see couples that both are dealing with gum disease. And number 5, dairy products can actually help prevent gum disease. There's some evidence that a diet that includes calcium and some of the other elements that help keep gums and bones healthy are all very beneficial. So that's something to be aware of. Number 6, if you have ongoing bad breath, it's probably a sign of gum disease. Let's face it, everybody has a little bit of morning breath. That's different. But if you have a continuous issue with bad breath, then you really want to get that evaluated because there may be a cause that's underlying that, which is gum disease. And number 7, sometimes people get fooled into thinking that just because they don't have cavities, that they don't have gum disease. 2 different conditions, 2 different sets of bacteria, both oral diseases, of course, but these are different. So just because you've never had a cavity doesn't mean that you couldn't lose your teeth from gum disease. That's one of the most tragic things that I've seen as a dentist is people that have great teeth, fantastic teeth, maybe never had a cavity, but they're losing every single one of their teeth because of gum disease and headed towards dentures. Number 8, brushing your teeth is good, but it's not enough. Gum disease often starts between the teeth in that little space that the toothbrush just doesn't reach. It's a harbor for bacteria. So this is an area that you want to be really diligent at cleaning out and making sure that the bacteria are disrupted there. So that's flossing, it's picking, little interproximal brushes, or water flossing is another option as well. And number 9, finally, pregnant women who have gum disease may put their baby at risk. Yes, there's some studies, some research that shows that if you have active gum disease, you run a much higher risk of having babies that are born underweight or are premature. And so if you're pregnant, it's a good time to go to the dentist and make sure that everything is okay. And if you're planning on getting pregnant, better time to go is before, and just make sure that everything is healthy. So gum disease is a fairly serious situation for a lot of people. A high percentage of people deal with gum disease. And if you have any concerns whatsoever, any type of bleeding or puffiness in your gums, please be sure to see a dentist. And remember that gum disease can be a silent disease as well. So there may not even be any evidence that you're dealing with it, and it could be going on to be fairly serious before you even know what's happened. And that bone loss that occurs is not reversible once it happens. So good idea to see a dentist if it's been a while. And here at ExpressDentist, we have a trusted network of dentists that you can reach out to. We are happy to help connect you. So please contact us and we will help you find someone in your area that can help keep your teeth and gums healthy. All the best to you and your oral health.